Curtis Page, thanks for coming up to Fort Worth from Austin today, the home of our healthcare practice. So if you mind, just start off, just tell us a little bit about yourself, your experience in the industry.
Well, thanks. I'm really appreciative of being here, really excited about our healthcare practice, and looking forward to sharing some things about the healthcare industry and our practice today. As I have been in the business over almost 40 years, really spent the majority of my time in my career focusing on the healthcare industry. But on a personal basis, I have 3 grown kids, one son-in-law, 1 daughter-in-law, and 3 precious grandchildren.
Well, that sounds great, Curtis. Thank you so much again for being here and doing this podcast with us. So, you know, we talk about the healthcare industry, and that means different things to different people. People think of their doctor, a doctor group, maybe they think of a hospital. But what is the healthcare industry?
Well, it's just about as broad of a term as you could possibly have, right? So when we talk about healthcare, we're talking about everything from an individual physician practice to a large group practice, hospitals, institutions, hospice, treatment facilities, med spas, and then we also need not forget that so many nonprofits that we insure have a healthcare component, whether it be a pharmacy within their mental health department or an actual practice where it's a clinic for free and reduced costs or those without health insurance. So it's just, and of course it's the most growing sector of our economy is our healthcare, because there's so much pressure, so many more people in the system, and all the issues that we've faced over the last few years, obviously.
The healthcare industry is an industry that has undergone so much change. And not even just recently, certainly it has recently, but just over really the decades, it has changed so much. Give us kind of the current perspective of the healthcare industry.
Well, you're exactly right, Chris. I mean, it's changed over the last decade. It doesn't even resemble what the type of accounts or clients that I had 20 years ago versus now. So it started obviously with healthcare reform, and really what has happened over time is that the seams have just been stretched to the limits. In fact, one of my associates said, we call it a healthcare system, and it definitely is not a system. It's really challenging and financially challenging, because over the last 10 years, the reimbursements have continued to be cut and cut. And so there's so much financial pressure on these organizations that it really impacts, obviously, staffing. And of course, now there's so many new risks, which we look at obviously in our business in insuring and or preventing risk that weren't present before. So it's really a combination of just stretch to the limit. Then one thing that's happened, we've seen so many physician practices or groups sell to hospitals or hospital chains because of all the same pressures that the hospital is feeling, the reimbursements, the cost of administration, and having to employ a separate person or team to deal with insurance reimbursements and such. So the admin side, so many practices and groups have just decided to offload that. And then really with, I guess, starting especially with COVID, but now as the economy is coming back, there's so much competitiveness for talented employees. It's just the same with us in our industry, but it's tenfold in the healthcare industry of trying to find people that will stay and within your budget, right? I mean, the salaries are increasing and the hourly wages are increasing, and it's just hard to find enough people. So that has added a pressure, and so that stretches, obviously, that affects the quality, obviously, of the healthcare.
You know, as a patient or customer, we focus on our relationship with our doctor or our PA or our nurse. And we don't really think a lot about the business that stands behind this and how that has changed so
Right.
much, which is obviously changed also the patient-doctor relationship. So it's our business really to understand the business behind the actual practice. Talk to us a little bit about that.
Well, that's what we do, is we have to analyze all the risks that, again, whether it be a treatment facility or a hospice group or assisted living facility, home health care, any of these organizations, they have just added more and more services and procedures that they never used to do before. And they're doing that because of technology, but also for reimbursements. They're trying to find ways to get additional revenue in the door. So when they're doing that, then that creates risk to their practice or their institution, like a hospital. So really, we're looking. As we tell our prospects and clients, the more information we have about your business, the better job we can do, from financials to every single procedure or whatever the case may be. And so we really pull back the curtain and dig deep, get very granular in our analysis of trying to figure out their business model, because then that drives their exposures, right? That's the consequences of how they're running their business.
That's a great segue into the next thing I wanted to talk about. You mentioned just it drives their exposures. So let's talk a bit about the critical and highly important coverages that a healthcare practice, broadly speaking, and I know this may vary a little bit, but broadly speaking, what coverages are critical to that group?
Well, I think everybody would know before I say it that the cyber attacks and ransomware attacks are the most critical issue going on in a healthcare organization. They have, and you think about it, the risk is that what we call the personal identifiable information, PII. And so they have a treasure trove of data, from what prescriptions I take to the procedures, to my social benefits and everything. So they are a target unlike any industry that we've seen. Of course, we work in the healthcare space so consistently, we see it. And Chris, really, it's almost weekly that we have a healthcare account that has a ransomware attack or a cyber attack or a breach or what we call social engineering, which is that new phenomena of using a familiar email address but changing it slightly so that you respond and you open up, they can get their records. And so just real quickly, we had a large group, orthopedic group, that one morning at 6 a.m. was notified or requested it had a ransomware attack. And they began, the bad actors began shutting down their systems one at a time and requesting a $250,000 ransom to stop. So they went through the building. They went then, as far as the actual facility, lights, electricity. Then they went into accounting, which of course would get into their billing system. In this case, their electronic medical records were under a separate server, which was great. But they realized throughout the morning that they were shutting down system after system. And the next threat was, we're gonna get into your medical records. And so in this case, Chubb, who was the underwriter, did a tremendous job of getting in there immediately and shutting down the attack, but ended up having to pay a $250,000 ransom to get it stopped. So cyber is paramount. But
Let's stop there for just a second, talk a little bit more
That's good.
on
I got to take
cyber.
a breath, yeah.
So Our industry is very dynamic. There are ever-changing exposures that's created by expanded businesses, new technologies, and then there's this cyber thing. And I would say that as many changes as our industry has seen over the years, nothing compares to what we're facing right now with cyber. We all rely on our computer systems, our data, our servers, our technology, if you will. All businesses literally depend on that. And at Higginbotham, obviously, we have just worked to build a system that helps our clients understand their exposures, quantify their exposures, and then close as many gaps as possible on the risk side, and then fill the remaining gaps with insurance.
Absolutely.
And I would just mention two things that I know we've worked on our cyber teams, and it applies certainly to the healthcare industry, and that's running what we term as quick glance reports on clients where needed to evaluate their system security and see where there are gaps before what you just described happens. And even if you do it really well and you close those gaps, that's closed for today. So this is a war that starts anew every day.
No question.
The good guys on defense, the bad guys on offense. The other thing that we have done of significance is we have licensed a firm called CyberCube, and that's to quantify the possibility of a certain level of loss given a certain attack based upon that customer or prospect's security and the industry in which they're in. So we get these hard questions like, well, how much should I buy to cover all of my losses? And we can guess on that, or we can use some of these third parties and some of our services to really quantify that and provide more specific coverages around this healthcare practice. So any final comments on the cyber before we move to other coverage types?
Well, I think we've generally covered it, but this is such an important step we have taken to engage these partners to really evaluate, because prevention is everything. You can insure a risk, you can contract it away, or you can self-insure it. So we want to make sure and prevent as many of the opportunities for claims, because ultimately that obviously affects their claims history. And another thing that you and I know, we are in the trenches daily fighting large rate increases on cyber liability policies, even if a client hasn't had any claims. They're just so frequent, and especially in the healthcare space, it's just the rate increases are very difficult to swallow. And I'll make one last comment on that. I mentioned about the stretch on the finances and the pressure on the bottom line. Well, of course, we all run our businesses for that bottom line. But what we've seen is executive level or C-suite folks literally having to cut limits of coverage to keep their expenses down or their insurance, no matter our recommendation or the benchmarking that we've done to support a certain coverage limit. We had a very, very robust practice that's growing that had a $3 million limit on cyber liability, dropped it to $1 million, which just upset me, but they have to pay the premium. So it was their decision, but it was all because of the price increases. And we would have rather seen them cut in other areas than the cyber, but nevertheless, that's the reality, is everybody is stretching the dollar as much as they can in that healthcare space.
So for a quick summary before you move to your next coverage type, evaluate, quantify, close the gaps, ensure those gaps, and then be ready to respond if and when something happens.
Absolutely. And the carriers we pick as partners for our clients, we evaluate their response and what they do after the breach as much as their coverage and cost of the policy.
So move to the next coverage type that would be next critical. coverage in this industry?
Well, really the entire portfolio of coverage is built around professional liability or medical malpractice, and they're different. Professional liability is the type of coverage that would ensure that vicarious liability of an institution in the event of an allegation of medical malpractice or whatever. Then we think of medical malpractice, that is on the individual physicians or the nurse practitioners or the physician assistants. And so both of those have to go hand in hand. When we look at account, so often there are gaps between those two coverages that are really, frankly, easy to fill, but the client just generically thinks, well, I have a professional liability policy, and so I'm good. Or I have a medical malpractice policy from my doctors, so I'm good. And the fact is, they may not be, likely aren't properly insured because someone hasn't really got into the details of that coverage. So that's really the backbone of an insurance program. And so that professional liability could be for, obviously we think of the practice of medicine, but it's the pharmacy distribution, and it's the treatment facility, and it's the way they go about running their business, all of that. So that's another one. One last thing on this is that another thing that's going on, I mentioned earlier that they're adding new procedures, they're, if you will, kind of pushing the envelope. Well, the pandemic, as we know, changed everything. And one of the things that has now just commonplace, and it's not going away, is telemedicine, teledoc appointments. And so that adds an entirely additional level of exposure for a group practice. It may seem like, why would that be the case? But think about a psychiatrist that is having a teledoc visit and can't see they might could see the person, but they can't really read the body language because they're not sitting across from them. And maybe they're on very strong medications for, serious things. It's I would suggest impossible to get the same kind of evaluation of a patient that you would in person. And that may be an extreme example, but you get what I'm saying, is that it's just different. And so it's here to stay. It's a great thing in so many ways, right, for just check-ins. But we need to make sure that's properly insured. And that is a potential exclusion on professional liability policies that we need to eliminate, or we need to make sure that it has as much coverage as the basic office visit that we were always used to.
Mm-hmm. So then we'll have our basic coverages, our property, our general liability, our transport or automobile, an umbrella to provide some excess limits. And then what about the D&O, directors and officers coverage, employment practices, and that line of coverages within this industry?
Well, again, these are critical coverages. Maybe this is the ribs of the program as opposed to the backbone, but directors and officers liability integrates so closely with professional liability and medical malpractice, medical directors serving departments for healthcare institutions. That all has to be coordinated, and really the definition, if you will, on directors and officers liability needs to be, of who is insured, needs to be expanded. But I don't want to get into details, but the importance of directors and officers liability, and even more importantly, employment practices liability. We have seen a large increase in the frequency of allegations of wrongdoing in the employment practices space, both first party with your employees and third parties, those that visit your office or vendors. This is one thing that's not covered under a medical malpractice policy, by the way, is the employment practices liability, because that's not the practice of medicine. So we see claims, unfortunately, or allegations, I should say, of wrongdoing in the office hospital setting. So it's very critical to have the directors and officers liability, the cyber liability, the employment practices liability, the crime coverage, we call it, or employee dishonesty, with the same carrier, so that it all integrates and is just a neatly tied package.
So Curtis, you covered a lot of territory about coverages. Talk to us a little bit about some emerging exposures of something we see in healthcare today that may be surprising to many of us that we wouldn't have seen 20 years ago.
Well, that is a very broad question, because it's amazing what different procedures, how they're going about the procedures, the setting in which they're doing the procedures are expanding just very rapidly. I mentioned earlier about how hospitals and groups have purchased physician practices and are subbing out or contracting out services like emergency room services or any other services that they can't find physicians for to have. So that's off the subject anyway. So not only the procedures and just pushing the envelope, I think we were talking earlier and I told you about a group that we insure that was going to start having procedures done under general anesthesia versus that mid-level anesthesia that you're just in the twilight zone. Well, that sounds like what's the big deal? But it is a big deal, because these procedures under general anesthesia were not covered under their current policy. So we needed to get with the underwriter and make sure, and if there was a premium charge, so be it. But little things like that aren't so little to an underwriter or to creating a gap in coverage. And the last thing I'll say is what we've really seen, again, back to this financial pressure, stretching, or whatever, we've seen that many organizations are forced to take the eye off the ball on risk management, prevention, safety, what we call loss control, the prevention side of the business. Not that their heart doesn't want to do that, they just simply don't have time or have the money to, for example, to hire a risk manager or such. So, just like we know in our businesses, the financials drive decision making, and they have to, because we want to run our business efficiently and profitably. So that is a real struggle. That was back to my example of the physician group dropping their cyber liability from $3 million to $1 million. I mean, it's just a scary decision, and that's an example of that.
I'm glad you went there, Curtis, because another thing I wanted to talk about is something that is a secret sauce of Higginbotham, and that is our day 2 through 365. After we've identified the risk exposures, we've placed the insurance coverages. Now what are we doing to control costs for our clients for the rest of the year? We call that our day 2. So as it relates to our healthcare practices, what are we doing on the day 2 side of our business?
Well, it is our secret sauce, and we find that this day 2, or those after the placement takes place on day 1, which is what we call that analysis of coverage, cost, and cash flow, day 2 through 365 is where I will tell clients or prospects where we earn our keep. These are such talented folks that we have hired to support our clients, and this includes any kind of risk management. We're talking about the area of reviewing their contracts for indemnification and liability limits. Then we're talking about safety visits and loss control, where our talented individuals, certified talented individuals, will go to an organization and do surveys or do training or meet with employees if there's been safety issues or losses within a certain facility. And then we have a very robust, as you know, risk management software platform that really aids in training of the employees and really supporting them in that way. And then we can't understate the value of our claims team. I mean, we see that team move the needle daily, where clients will have an allegation against them, and an underwriter, an insurance carrier, may take a position that there's no coverage or limited coverage. And then we advocate, truly advocate, on behalf of our clients to get them the most coverage under those four walls of that insurance contract, that policy. And we've seen success in that. We're not always successful, but we have seen opinions turned with supporting court cases and such. And this is especially helpful in healthcare because of our society, we know that litigation is so prevalent, especially in this space with the opportunity for quote unquote deep pockets. And so this group is truly advocates for our clients, and I could give example after example where we've been successful helping our clients, get claims paid.
So Curtis, you've shared some great information about our healthcare practice. There's between 30 and 40,000 agents and brokers in this country, and so you have to ask the question of why Higginbotham? Why should one choose Higginbotham for their healthcare practice and trust us with not only placing the insurance, but providing the risk management? So tell us a little bit about your team, about our day two, whatever you want to talk about as to why Hig.
Well, I appreciate the question, Chris, because it really is. We have just structured our firm so perfectly to address any industry's needs through our specialty practices. And in our case, our team has years and years of experience having virtually written every type of healthcare account that is out there and the new ones that are coming along. So the experience is critical. Just like a physician, we see specialists. You and I go to a specialist for certain critical issues, like my cardiologist that I visited yesterday, a specialist. Well, in our business, it's a specialty business now, and it typically is done by industry. So that includes the property and general liability and cyber liability, but the industry experience is key. Another thing that is why Hig is because we have built incredible partnerships, close, trusting partnerships with insurance carriers. We insure our clients with all the top insurance carriers in the country. And that's another thing. We're based here in Fort Worth, and I'm in Austin, but our healthcare practice is based in Austin. But we have capabilities to write these healthcare organizations throughout the entire country. And as we have expanded, we've seen our brokers and agents in other locations contact us to really seek that experience. And one thing you and I know is also the insurance carriers want to work with people that are experienced in this industry, work with brokers that have knowledge of the space so that they can negotiate on our behalf the best possible program for our clients. So Andrew Guyton is our senior account executive in our healthcare practice. Then we have Nick Rollo as an account manager. Both have a lot of experience. And then we have others in our team. And of course, then we have our entire day two team. Vance Lee is our managing director of risk management. What a talent he is for Higginbotham. He has gone all over the country to meet with people, employees, and leadership of healthcare organizations for healthcare risk management, prevention side. We have such experience. Of course, Vance is the leader of that team, but then throughout our whole risk management group, so many people that have experience and just practical hours on the job at healthcare organizations. So, we insure with national companies like the Doctors Company. We have Texas Medical Liability Trust in Texas, but then they have a companion company that writes in other states. We have Medical Protective, we have Pro Assurance, then we have Beasley in the London market to insure professional liability. Of course, there's always the AIGs and the Chubbs and the Travelers that obviously write all over the country / all over the world. So did that answer your question?
Yeah, so what I'm hearing you say is we have some pretty dramatic experience starting with yourself, but then your team that really just understands the industry, how to identify those gaps, and then ensure those gaps. Then we have the day two team, which has very nice healthcare experience that has a myriad of experiences with various healthcare practices, identifying exposures and trying to prevent the loss before it happens. And then it sounds like we have a myriad of carriers, a great platform to actually be the paper behind our experience. And then the claim handling on the back side of this with both our team and our relationships with our insurance community.
That's absolutely the case. And what is dynamic about our business, you mentioned that earlier, and in this healthcare industry, as we expand as a firm, we are partnering with new carriers that may specialize in physicians that do spinal surgery or the gynecologist or such within that state or that region that may be more competitive than some of the national companies. So we're learning a lot as we go, but the key is that the specialty practices, the towers we call them, have been so strategic as we've expanded, and that we really can serve all the needs of our customers. And you take a healthcare account, property is a huge exposure, and we know that that's a very tough placement in this market. Well, we have a property practice that we would engage on a placement. Then we have a specialty practice for directors and officers and management liability headed up by Gray Holden in Oklahoma City that we would engage. So you've heard me say many times, I think people are tired of hearing it, but this is the most team sport company that I could ever imagine working with. And so everybody is ready to drop what they are doing to help us get the best program put together for our clients. So the experience, the carriers, and just the knowledge of the space is critical for folks to consider when they are hiring a broker. And that's why Higginbotham is a special partner. And really, this is going back again, we really are able to be that outsourced risk management department or risk manager for these organizations. When we partner with them, that's what we're doing. We want to take that work off the CFO or controller's plate to really allow them to focus on what they're best at and allow us to really perform under our stewardship report and timeline to where we really set forth goals and guidelines for prevention as well as the competitive placement of coverage.
Well, Curtis, I'll tell you, we're very proud of the diverse businesses that we insure at Higginbotham. And then we've developed over the years these specialty practices that drive us much deeper in our knowledge of what our clients' exposures are in those areas. And that certainly includes our healthcare practice, very proud of that and what our capabilities are and what we do for our clients. So for that, congratulations. But let's get back to work. And thanks for making the trip up to discuss this today.